one, guys, let us simply talk about the management or the treatment of a neonatal jaundice. Like, as we all know, that whenever a baby come up with a neonatal jaundice, the most treatment that majority of us know is to pick our baby or carry our baby and place them under the sun, under an early morning sun, which is very, very wrong sometimes, because when you talk about the management or treatment of neonatal jaundice, it is not just about carrying the baby and placing the baby on early morning sun. There are certain management that the baby needs to take, which is different from that type of therapy you are giving that baby at particular instant. When it comes to the treatment of a neonatal jaundice, it depends on the type of neonatal jaundice the baby has. So for the purpose of this video, I am going to give you about 4 different treatment or 4 management you can actually give a baby with a neonatal jaundice, irrespective of the type of jaundice that the baby have. So if you're just coming across our video for the very first time, you're welcome to my channel. Don't forget to subscribe, like, and share our videos. Comment your question under the comment section and answer will be given to you. The treatment and the management of neonatal jaundice. Number 1 is when a baby come up with a neonatal jaundice, the first thing or how before you can manage it is for you to monitor the bilirubin level. That is the number 1, because monitoring the bilirubin level will give you a clue on how the management is going to be. So your healthcare practitioner or your pediatrician is going to take a blood sample of the baby so as to go and do investigation about the amount of bile that have built up in this baby's bloodstream before you can know the type of treatment that such baby can actually can take. Then another type of management or another second management or treatment you can also give is phototherapy. This is all known by majority of us. What does phototherapy comes about? Because it is not just about placing a baby under an early morning sun. Phototherapy is the exposure of a baby with neonatal jaundice under a blue light. So the baby is being carried to a pediatrician unit or to the pediatric unit, and they uses a blue light, a phototherapy machine, which has a blue light, such that as this blue light penetrates into the baby's body, it tries to absorb those bile that are stored or that are flowing or excess in the blood stream or in the blood vessel. So that is a second management or second treatment you can also give to a baby living with a neonatal jaundice. Then number 3 management you can also give is blood transfusion. In the case of blood transfusion with baby with neonatal jaundice, it occurs if there are a lot of or excess damages, or there are already organ damages in the baby's body, but probably the baby is premature or due to organ prematurity, which is the liver prematurity. The excess bilirubin level in the bloodstream is already causing damages to other organs. Also, if the bilirubin is more than necessary in the bloodstream. So in this kind of situation, the baby's blood is being withdrawn completely out of the body, and this baby is being transfused another new set of blood depending on the severity of the jaundice due to excess of breakdown of red blood cells due to this neonatal jaundice. So blood transfusion is another management we also use in treating neonatal jaundice that every one of us needs to know. And last but not the least, for the purpose of this video, type of management we'll give is for you to know the underlying cause. If it is as a result of sepsis, you know that definitely such baby have to be treated for infections so as to reduce the risk or the rate at which the red blood cells are being broken down. Then if it is as a result of breastfeeding jaundice, the baby will have to be put to a proper lactation. The baby will have to be put into proper latching and proper positioning during breastfeeding, so that the baby can take enough breast milk during breastfeeding time or during his own meal. So in this kind of situation, that's if it is due to breastfeeding jaundice, you ensure that the baby is breastfed well and every time, so as to let the jaundice or the yellowish discoloration of the eye or the skin goes away within short period of time. So these are some of the management that we have or that we use in the treatment of neonatal jaundice, and not just by putting the baby under an early morning sun. Without knowing the cause, you won't know which of these management that will be required for your baby. So it is always advisable that immediately after you put to bed, a pediatrician takes the blood of the baby or take the blood sample of the baby for bilirubin test, so you can check if there are a lot of bilirubin level in the bloodstream, so as to know any possible risk of neonatal jaundice. Or if the baby have come up with a neonatal jaundice, it's also advisable they go for a bilirubin test, so they can also know the amount of bilirubin level and how or the best treatment they can actually give this baby at this particular time. To get more of this video or to get more of these healthy tips, don't forget to subscribe to my channel, like our video, comment your question under the comment section, and YouTube will surely give you this video next time. If you want to know the various causes or what can result to neonatal jaundice, this is a video I've made before. Click on this video and YouTube is going to show you how neonatal jaundice come about in your baby and not the severe form of malaria that we think it is always the major causes of neonatal jaundice. I will see you in the next video. Thanks.